We are coming live from South Africa, of course, but everywhere else in the world through this digital platform. So in South Africa, we say good morning. I suspect we may be saying good afternoon on those who are on the east side of the world, and maybe very, very, very good morning to those who are on the west side of the continent. So this is our BioAfrica convention, the digital one, fortunately because of the pandemic that we all are aware of. This BioAfrica Digital Convention has a theme, advancing Africa's biomanufacturing value chains through innovation. We have great speakers lined up for you in this opening ceremony, and I'd like to upfront express my sincere gratitude to all of them, starting with the president of AfricaBio, of the convention, Dr. Ntanzapsomi. I do know that he has been working hard to make sure that this happens, and I'm grateful that he has put together such a great program for us, of course, with his team. I'm also extremely grateful and thankful to the mayor. We know how busy he is, and we know what's happening politically in South Africa at the moment. So for him to take his time out to be with us this morning, we are extremely grateful. We have our Deputy Minister of Science and Innovation, Higher Education, Minister Kutimana Melo, and we are extremely grateful, Deputy Minister. We also know what's happening in the sector and the challenges that the sector has, and for you to be able to find time in your busy schedule to be with us, it's extremely appreciated. And then lastly, we will also be joined by another extremely busy person, Dr. Joe Butler, the Honorable Minister of Health. We also all know how busy he is in South Africa with us ramping our vaccination program. So I just want upfront to express my sincere thanks and gratitude to all the four speakers that will be addressing us this morning. I also do want to acknowledge a range of international partners, too many to mention here. Such a convention and its gravitas is strengthened by the partnership that we have in the rest of the continent as well as globally. We are also extremely grateful and delighted and indebted to a range of sponsors that will be announced during the convention, and we are also extremely grateful. And most importantly, of course, all of you as participants, because such a great meeting would get nowhere if only the speakers are available and it's only the speakers that are participating. So for all of you who are participating, I do know when we do have these events physically, it's participants from all over the world. So we are extremely grateful that you've joined us in this meeting. The second point that I'd like to make is that meetings of this nature are reminding us of a couple of things. And because this is happening during this pandemic, a couple of points that I'd like to make. The first one is that what this pandemic has taught us is that investing in science is not an expense, but it is an investment. And you will be hearing from a range of speakers how investments that have been made in this sector have really provided us as humanity, not only us here in South Africa, but as humanity, with the answers to some of the challenges that we have in COVID-19, whether it's understanding the variants or whether it's starting to repurpose science investments that were made long time ago to be able to have diagnostics and or even to get vaccines, and you hear that immediately in the second session. So investing in science, there is no substitute for it. The second one is that it reminds us that we are really an interconnected world. What happens on the east side of the globe, what happens in the north, south, and west affects everybody else. And therefore, the partnerships and the global partners that work with us in this are, again, greatly appreciated. And this pandemic has told us that you can't be an island in this work of science, innovation, and technology. So with those few words, I think I'm ready to invite the first speaker. And as I say, you'll hear more about some of these issues that I have made and what they mean to society. But without further ado, let me then invite the President, Dr. Msomi, to give us his remarks. Dr. Msomi, over to you.
Thank you, DG. I would like to greet the Honorable Minister, Your Worship, the Mayor, the DGs and other dignitaries who are present here today, as well as the more important dignitaries, which is the delegates who have taken their time to attend the convention. On behalf of the organizing committee as well as AfricaBio, the hosting organization, I also want to send sibling greetings to our sister organizations all over the world in the form of the International Council of Biotechnology Associations, as well as Bio International, as we would say in this part of the world. We warmly welcome our partners, the International Center for Genetic Engineering and Biotechnology, for always responding to the now urgent call of South-South collaboration. If ever there was a time to emphasize and to recast the idea of a South-South collaboration in building innovation coalitions across the world, it is now. So we thank you, ICGP, for responding to our invitation. We launched this year's convention, which is the fourth one, as the DG has indicated, in pursuit of biotechnology innovation. And biotechnology innovation has never been more important. We've had biotechnology, the modern form of biotechnology, for about half a century. And I think the events of the past 2 years have brought to the fore the need for more investments in biotechnology, because in biotechnology we will find the solutions to this current pandemic. We were able to develop vaccines, and you'll hear more about it in the first session today, within 2 years, an unprecedented time to develop vaccines that work. And this is thanks to the biotechnology innovations. But the one thing that I want to really applaud was that we've always had the science, but we've never had the type of solidarity that we've seen globally, with scientists all over the world, innovators all over the world, and companies all over the world working together to provide something that would provide relief to humanity and possibly save humanity. And there's a lot that would come from this biotechnology. It's growing up. This is our 21st year as an organization, AfricaBio. And usually in our culture, when somebody turns 21, we give them the key that says you're now an adult. And I think as a community of biotechnology innovators, we need to demonstrate that we are ready to take responsibility for what we are supposed to do for humanity. I am also grateful to the organizing committee, which for the first time this year has included very senior biotechnology innovators and scientists and practitioners from across the continent. This truly is a Bio-Africa. It's no longer a Bio-Africa that is just based on the southern tip of the continent. The participation of our colleagues from across the continent augurs well for this biotechnology. And I want to pay tribute. The convention was opened by the DG of Science and Innovation. And I want to pay tribute to the Department of Science and Innovation and the government of South Africa for staying on course for the past 21 years. The first biotechnology strategy was developed and launched about 21 years ago. And for a government of a developing country to stay the course, because investing in science is almost never something that is a high priority. But we've seen this commitment over and over again, and we're starting to see the fruits of that. And we hope that this event, being a huge event during the time of COVID, and when we go through the program, as we go through the next 2 days, you will start to see the phenomenal work that is coming out of those investments, not just in this country, but in other countries across the continent as well. And notable for me, at least personally, and particularly proud moment is to see the strong presence of young African innovators from across the continent. And I invite you, everybody, the delegates, to view in or to dive into the conversations of young innovators in diaspora and in Africa who are making connections and building bridges to deliver the value that that Africa needs. We have innovators that are based in other countries such as the US who are making or developing vaccines for malaria. And I just want to digress a bit. Malaria has been around for over a century, yet we do not have an effective vaccine. HIV is on its 40th, 50th year, no effective vaccines. And this talks to a very important point of why we need a Bio-Africa, why we need to have conventions that are defined by ourselves, that are driven by our own agendas, because the COVID vaccine as a pandemic, or the COVID pandemic, led to a very rapid development of vaccines because it did affect everybody equally, the global north and the global south. When pandemics or epidemics are localized in the south, the type of resources that we've seen being thrown at this particular pandemic would not normally happen. We don't have a vaccine for Ebola, despite its massive devastation. As I said, we don't have one for HIV AIDS. And I think that's an incredibly important point to remember, that Africa's future or Africa's hope lies in its young population. I'm told by accounts 60% of that population is under 35 years of age. And therefore, the investments that the DG speaks about in innovation, in research, upstream and discovery science needs to be directed at these young folks. Later on in the program tomorrow, we would have a Nobel Prize winning scientist, Sir Richard Roberts, who talk about the possibility of our continent, if we leverage the intellectual capital that we have, to be able to produce our own superior or elite seeds that would start to roll back food insecurity. We are also very grateful for the presence of multinationals as well as local companies, because as much as we who are on the bench, who are in the science space, do the work that we do, it has to get into the clinics, it has to get into people's kitchens, and the only way that you do that is that you have to traverse the path into the commercial space. And the presence of strong multinationals and local companies such as Aspen, BioVac, is a very, very important and very positive signal that we are starting to connect the dots. I think in trying to move to the end, I want to again go back to the theme of how we as a community of innovators and scientists in biotechnology, the obligation we have to humanity and the need for us to find a common humanity and a voice. Right now, the big issue is around vaccine nationalism. But the reality of that issue is the issue of the fact that there is not an equitable distribution of the fruits of innovation. And it's the time that the scientists and the innovators find their voice, because innovation and science is a human endeavor, it's a human enterprise. It is subject to the same human weaknesses that we have around exclusion, around discrimination, around dispossession, and we cannot continue as if science and innovation is value neutral, because it isn't. We are seeing with the vaccine nationalism that it is not value neutral. And I hope that today's lunchtime plenary, which features women leaders, will be able to expose us to some of the thinking of how do we find solutions to spread the fruits of biotechnology innovation equitably, especially to those who are most in need. As BioAfrica, from the day we started, we committed ourselves to ensuring that we lead the fight against discrimination, against all forms of exclusions. Whether these exclusions are based on gender, sexual orientation, sexuality, and any other form, even the shape of people's nose. It's our job as life scientists, because we sit at the interface of the human enterprise as well as the spiritual domain, if you want to call it that way, that we cannot be seen not to be doing something. We have to practice what we were taught in our original training, that recombination, genetic recombination, often leads to better and to bigger. And if we ourselves, by the way we behave in our organizations and in our institutions, we drive agendas that are designed to exclude the vast majority of people, whatever classification we use, then we are not being scientific. It's as ascientific as anyone can be. And I think the last bit that I want to highlight over the next 2 days, we have, when we started the convention, there were a lot of naysayers, particularly based on the stance that we took of trying to transition Africa from being consumers to being innovators for our own needs. And we realized very early on that we are playing a bit of a catch-up game, and the way that that catch-up game we could make the distance would be internationalization and partnerships with global players. I'm glad that in this year's convention we have such notable scientists and labs from the global north, one of which is Dr. Dennis Liotz's lab, which is responsible for converting what was essentially a death sentence, an HIV infection, into a manageable chronic disease. So he'll be with us later this morning, and the team that, incredibly enough, is a team that owes its origin from this very continent and this very country. A bit about the convention itself. We start the convention by discussing the vaccines on which our survival depends, and I'm very enthused by the fact that we have incredibly important contributors to the vaccination campaign in this country in the form of Aspen, BioVac, as well as the WHO, as we seek to create global vaccine hubs. So that is an incredibly important part. The second part of the morning would be with diagnostics. And my biggest or my proudest moment with regards to the diagnostic session is that it also involves one of our own young scientists who, by his example, is charting a path that we hope as BioAfrica would be taken up by a lot more young people. Daniel Ndima, whose COVID-19 diagnostic kit, molecular diagnostic kit, represents a groundbreaking moment for the continent, for the developing world, and we hope that he will receive the support that is required to ensure that others are inspired by his example. And I think with those words, I'd like to warmly welcome everybody, thank the organizing committee for allowing me to be Delisha on their behalf, or Waful on their behalf. Thank you. Welcome, and please enjoy the next 2 days. They promise to be something like you'd never experienced before. Thank you.
Thanks very much, Dr. Msomi. This pandemic is robbing us of having things like a thunderous round of applause, but believe me, we're extremely grateful to your message. The first one is that science for justice and science for economic growth is important, and I think we all agree on that, and that as Africa, it is our time to get us going, and I've seen some exciting sessions later today where I think Africa and scientists in Africa will be deliberating on where to from there. So extremely grateful to your address, President. So it is now my duty and my honor to request His Worship Councillor Mxolisi Kaunda, the Executive Mayor of eThekwini, to welcome us. We are very much aware, Mayor, that by speaking before you and before we are welcomed, we are breaking the protocol, but we hope you'd excuse us. So over to you, Your Worship, Councillor Mxolisi Kaunda.
Thank you very much, Director General, Dr. Phil Mjwaha. Our keynote speaker today, the Deputy Minister of Science, Innovation, Higher Education and Training, Comrade Buti Manamela, Honorable Buti Manamela. The AfricaBio President, Dr. Msomi, who just welcomed us with his address. Distinguished guests, delegates, ladies and gentlemen, members of the media, good morning. On behalf of people of eThekwini, we wish to welcome you all to this important gathering, the Bio-Africa Convention. To us, this is not just an academic convention, but an opportunity to showcase the African innovation and technologies in the biotechnology sector, and to further commit to the African shared vision of fostering development and relationship with Africa's biotechnology sector. We strongly believe that biotechnology presents possibilities for economic growth in Africa through research and innovation. And we believe this could help secure a better future for generations to come. We are deeply honored to host this prestigious event at this time following the civil unrest that was experienced by the city and the province in July this year, which resulted in the loss of lives and destruction of infrastructure. This gives us an opportunity to once again showcase our city as a destination of choice. The fact that we are gathered here today as different stakeholders coming from various parts of the world is a clear indication that the situation in eThekwini has returned to normal and Durban is now open for business. As the city, we are supporting all efforts to ensure that businesses operate as they used to, and most importantly, we remain committed to working with investors to grow and safeguard their investments. Ladies and gentlemen, we are pleased that since its inception in 2018, the Bio-Africa Convention has grown from strength to strength. Credit must go to the organizing committee led by Dr. Msomi and his collective for the sterling leadership they continue to provide in steering this ship to the right direction. Ladies and gentlemen, despite the COVID-19 pandemic, the number of delegates both local and international increases every year. This has enabled us as a city to promote our destination for foreign direct investments, tourism, and the life sciences sector. You truly deserve a huge, big round of applause. Program Director, our partnership with AfricaBio and PC, which represent the interest of all stakeholders in the biotechnology sector, has enhanced the municipality's agribusiness and agroecology programs through research and development. This has also improved the standard of our emerging farmers as they are now able to overcome structural and competitive barriers. We have no doubt that this initiative will continue immensely to the acceleration of government's program to radically transform the agricultural sector in our society. Ultimately, our goal is to extend this to other sectors of the economy, such as industrial and medical fields, so that we become a leading destination in South Africa for biotechnology. We plan to achieve this through investment promotion, business support, and investor aftercare. Ladies and gentlemen, we are excited about the economic opportunities that are presented by the biotechnology, particularly in the area of green economy. We were the first city in Africa to develop a climate change action plan, and in 2019, our city was declared as the greenest city in the world. Therefore, we have no doubt that these biotechnology initiatives the city is undertaking will contribute positively to our climate change mitigation and adaptation strategies. Ladies and gentlemen, we are a city that embraces radical socio-economic transformation, and we are unapologetic about our call to ensure that all sectors of our country's economy reflect demographics of people of eThekwini. For the longest time, the majority of people of this country, blacks in general and Africans in particular, were deliberately excluded from participating in the mainstream economy of our country. As a democratic government, we must correct this injustice, as you all know that our historical mission has always been to create a non-racial, non-sexist, democratic, united, and prosperous society. This noble goal can only be achieved if we change the structure of our economy to serve all its people. It is for this reason that as a city, we have introduced procurement reforms that will allow the people who were marginalized to participate in the mainstream economy of our city. Therefore, as we forge ahead with this groundbreaking initiative of making Durban as a preferred investment destination for biotechnology, we must ensure that it is inclusive and leaves no one behind. Let us ensure that we remove all barriers to entry. Ladies and gentlemen, we are told that one of the critical barriers to success of many companies that are operating in the space in research and development development cost, which tend to be extremely high. Therefore, it does not require rocket science to know that young entrepreneurs from KwaMashu, Mbumbulu, and other areas in deep rural areas and township who has an interest in particular in this sector will stand no chance of succeeding if we do not address those barriers. For us to overcome these challenges, we need to form partnership that works. In this regard, we must strengthen existing collaboration efforts of the CC with the University of KwaZulu-Natal, and we want this partnership to translate into scientific excellence. That's where we want to go. We want to be able to tap into our vast biodiversity and turn it into new commercial products. The private sector, particularly the established companies, must also come on board, because it is only when we work together that we can address the developmental challenges facing our country. We therefore expect establishment firms to open their doors and partner with small companies and social enterprises in particular in the area of research and development. For instance, at eThekwini, we have a strong presence of leading industry players in the pharmaceutical, digital, and chemical space who can partner with us as a city. We must also take advantage of other key assets of biotechnology at our disposal, such as Durban Trade Port, Innovate Durban, and Ezimbabwean Technology Innovation Agency Bioprocessing Complex. In conclusion, ladies and gentlemen, it is significant that we host this event at a time when the country commemorates the Women's Month, in the month when we celebrate and honor women contribution in the struggle for freedom. This is a reminder to all of us of the important task ahead to help improving the status of women in our society. As the leadership of the municipality, we remain committed to creating a conducive environment for women to strive in the sector and contribute to building a technologically advanced nation ready to compete globally. Ladies and gentlemen, therefore, we are optimistic that you will use this convention as a platform to encourage more women to participate in the science field in general and biotechnology. To the senior management of our municipality, we want to assure you that we have the potential to be the leader in the biotechnology sector in this country. However, we will not be able to achieve this without strong partnership with key industry players, the academia, research institutions, both locally and internationally. With these remarks, Program Director, let me welcome you all and wish you a wonderful stay in our warm and beautiful city of Durban. Those who are here, we have no doubt that you will have fruitful engagement in the next 2 days. Therefore, we welcome you and wish you all the best. I thank you.
Thank you very much, Your Worship, Councillor Mxolisi Kaunda. We are not taking your continued support in hosting this convention in Durban lightly. It's always a venue that is great where it's located, but we are always feeling extremely warmly welcomed in your city. So even with these words, we still feel, even though some of us are not around, really welcome. The second point that I'd like perhaps to comment on is the issue of the vision that you have for the city. I'm almost certain that we as a department and the Ministry of Higher Education, Science and Innovation will be knocking on your door and the rest of your team to look at how we can make that vision a reality, whether it's from the research side or whether it's from bringing more women into research or whether young entrepreneurs. As you know, we do have programs that can assist in making sure that that vision that you have is achieved. So we are extremely grateful again for your presence and for your kind words of welcome and the vision that you have for the city. And as I say, it's a pity we no longer have these events face-to-face, because usually in the evening we have a dinner that is hosted by the mayor. And I have seen many, many deals that are being signed off in those dinners. So I hope Dr. Msomi will work hard in making sure we are all vaccinated so that next year we can have this event face-to-face. It really is a great buzz. So, but again, thank you very much, Mayor. So it is now my honor and my duty to invite the Deputy Minister of Higher Education, Science and Innovation, Honorable Deputy Minister Puti Manamela. May I invite you, Deputy Minister, to give us your address.
Thank you. Thank you very much, Program Director and our Director General, Dr. Phil Mjwaha, Director General of the Department of Science and Innovation, and also Acting Director General in our Department of Higher Education. Honorable Minister of Health, Mr. Joe Pahla, Sir Richard Roberts, the Nobel Prize laureate in medicine, 1993, Councillor and His Worship Mxolisi Kaunda, Executive Mayor of the City of eThekwini, Vice Chancellors and Deputy Vice Chancellors of universities, Dr. Nhlanhla Msomi, the President of AfricaBio, ladies and gentlemen who are the most important part of this conference. It is my pleasure to welcome you to the fourth installment of BioAfrica Convention, the 2021 BioAfrica Digital Convention. It is indeed an honor for me to address this virtual convention on the pertinent theme of advancing Africa's biomanufacturing value chains through innovation. The theme for this year's convention is modeled on the global and continental push for local manufacturing of critical health products such as diagnostics, vaccines, and therapeutics. These priority areas are part of biopharmaceutical value chains, a sub-value chain of biomanufacturing. The development of manufacturing capabilities for biopharmaceuticals and active pharmaceutical intermediate holds great potential for South Africa and the rest of the continent. As you may be aware, many countries are besieged by a wide range of pressing social, economic, and environmental challenges that require, among other interventions, science, technology, and innovation-led responses. While the critical role of innovation is in encouraging economic competitiveness is well understood, its transformative role in responding to societal and environmental challenges is increasingly receiving global attention. In this instance, the role of innovation in addressing socio-economic challenges such as poverty, inequality, and the creation of sustainable and inclusive economic growth are the main drivers of the national agenda of most developing countries. Moreover, the critical role that science, technology, and innovation can play in addressing health challenges has become more pronounced and central to many nations' responses to the ongoing COVID-19 pandemic. In the wake of the COVID-19 pandemic, the development of biomanufacturing capabilities has become a strategic imperative of many countries that are driving a bioeconomy approach. For instance, out of about 60 countries around the world pursuing bioeconomy-related policies, there are currently 2 dedicated bioeconomy strategies that exist in the continent, namely the South African Bioeconomy Strategy that we launched in 2013 and the recently launched East Africa Regional Bioeconomy Strategy. The East African Regional Bioeconomy is a dedicated macro-regional bioeconomy strategy comprising several countries, including Burundi, Ethiopia, Kenya, Rwanda, Tanzania, South Sudan, and Uganda, and represents one of a kind macro-regional bioeconomy strategy on the continent. In order for the African continent to develop sustainable biomanufacturing value chains, other African countries would need to develop their respective bioeconomy policy instruments. Several international studies have reinforced the socio-economic potential of biomanufacturing and recommended its prioritization as a game-changing technology. From the South African perspective, biomanufacturing is an important cross-cutting strategy, a strategic focal intervention in support of the agricultural, health, and industrial sector of the bioeconomy. For example, in the industrial sector, biomanufacturing finds application in the production of chemicals, materials, and energy, whereas in the agricultural sector, biomanufacturing is a critical component of food, feed, and animal vaccine production. In the health sector, again, biomanufacturing is central in the production of biopharmaceuticals and vaccine. Critically, the area of diagnostics cuts across both health and agriculture and is often forgotten when we talk about biomanufacturing. You'd also be interested to know that our country's recently approved draft STI decadal plan prioritizes the importance of biomanufacturing innovations in modernizing manufacturing as part of high-tech interventions. Further to this, biomanufacturing capabilities are envisaged to be a central part of the government's reimagined industrial strategy, particularly in responding to the innovation priorities of the various sector master plans, such as agriculture and agro-processing, forestry, sugarcane and chemical, cannabis, and health sector master plans. As you know, the biomanufacturing value chain is extremely very broad, from proof of concept development to demonstration, piloting, and product development, and it cuts across various economic sectors. Notwithstanding the broad and complex nature notwithstanding the broad and complex nature by biomanufacturing, many socio-economic opportunities exist across the value chain. For example, biomanufacturing offers opportunities for small, macro, and medium enterprises development and also towards job creation. Biomanufacturing also plays an important part in the development of SMMEs. A typically small to medium biomanufacturing firm requires between 10 to 15 employees upon startup, and for every biomanufacturing job created, an estimated 3 supporting indirect jobs are created. Thus, the establishment of a viable biomanufacturing sector in South Africa has a potential to support job creation through acceleration of skilling and training of young researchers and entrepreneurs. In spite of these promising opportunities, Africa accounts for only 1.4% of the global biomanufacturing capacity, a strong indication that the continent is not harnessing the potential of biomanufacturing. This emphasizes the need to develop biomanufacturing capabilities on the continent. To develop these capabilities, the following are some of the important interventions that the continent urgently need to undertake. Since biomanufacturing, firstly, is a research-intensive field with high dependence on research and development, its outcome can be transferred to industry or taken to market. Support for new and emerging bio-innovation technologies is important as it forms a core component for the development of the bioeconomy in general and the provision of a competitive advantage in biomanufacturing in particular. The cost associated with building the required infrastructure is generally very high. In order to de-risk the biomanufacturing value chain, it is important to establish accessible and affordable demonstration, upscaling and piloting infrastructure based on open innovation model, and finally, the development of a skilled workforce as a critical component of building the biomanufacturing value chain. The technical skills needed to drive a sustainable biomanufacturing sector are extremely scarce and broad, ranging from early to advanced postgraduate personnel, and include highly skilled individuals such as bioscientists, engineers, and also entrepreneurs. Moreover, there is a need to develop critical skilled personnel to support bioentrepreneurship in order to drive business development and commercialization of bioinnovation. I will be remiss if I fail to underscore the importance of the manufacturing value chain in the development of biopharmaceuticals. I say this given the devastating impact of the COVID-19 pandemic that the world is facing. Currently, our country relies on the importation for almost all biopharmaceuticals and API needs. Through consistency and strategic investment in bioinnovation technologies and proper infrastructure, the continent stands an opportunity to localize the manufacturing of biopharmaceuticals. This will not only ensure security of supply, but also create jobs for skilled professionals. One of the challenges in bringing a new biotherapeutic is that the timelines are generally very long and the costs are very, very high. These are further compounded by demanding and stringent regulatory requirements across the product development lifecycle. To circumvent these challenges, some developing countries, such as India, are creating new market opportunities by strategically supporting the development of lower cost manufacturing of generics. Such an approach is seen as a suitable strategy for the provision of affordable and accessible biopharmaceuticals at reduced timelines and also at reduced costs. Let me share with you some of the examples that the South African National System of Innovation is supporting in this regard. This includes, for instance, the BioVac Consortium, wherein our government, in partnership with the Biologicals and Vaccines Institute of South Africa, or BioVac, has been supporting BioVac to develop and manufacture affordable quality vaccines to ensure security of supply for the local and regional vaccines market. In terms of localized biomanufacturing, we're currently most of the reagents, including those for the detection of COVID-19, are imported. This bottleneck creates an opportunity for the establishment of local manufacturing capabilities to service the country's growing reagent market reagent market needs. In this regard, we've been supporting the Cape Bio P2I Ltd, a small bio enterprise, which recently received SAPRA's approval for the production of COVID-19 test kits. In terms of the National Vaccine Development and Manufacturing Consortium, our partnership with the South African Medical Research Council, the Department of Science and Innovation, through the Health Innovation Strategic Partnership, is supporting a research consortium focusing initially on vaccine candidates for Africa COVID-19 variants, and more specifically on mRNA research. Furthermore, the NSI has been supporting various upscaling and demonstration initiatives aimed at de-risking the biomanufacturing value chain based on an open innovation model. Some of these initiatives includes the CSIR's Biomanufacturing Industry Development Center, which provides capability throughout the value chain, from laboratory scale, validation, to scale up and piloting, product prototyping, and small scale manufacturing to support the growth and development of a vibrant and sustainable bioeconomy in South Africa. And secondly, the Technology Innovation Agency, Umbo Ngintwini, bioprocessing platform, which provides bioprocess technical development incubation support. It is worth mentioning that sustainable development of local and continental biomanufacturing value chain rely heavily, in part, on fostering strategic partnership with the international community. In relation to this, our country is part of several strategic partnerships, which includes the International Center for Genetic Engineering Biotechnology under the United Nations Industrial Development Organization. And under this partnership, we're exploring mechanisms to leverage the intellectual property and technology transfer on biosimilars. Since 2019, we've been partnering with the ICGB to host workshops and biosimilars and vaccines. Secondly, the World Health Organization and its COVID-19 vaccine global access COVAX, the Medicines Patent Pool, France and other EU partners are working with our country's consortium comprising of the DSI BioVac, Afrigen Biologics and Vaccines, the Africa Center for Disease Control and Prevention, and a network of universities to establish its first COVID-19 mRNA vaccine technology transfer hub. This is the strongest signal yet that our persistence in building local manufacturing capabilities are starting to bear some fruits. A partnership also between J&J and Aspen and Pfizer and BioVac symbolize a huge step in the realization of our long-term vision of ensuring that Africa becomes self-sufficient in the manufacturing of critical vaccines and drugs. While Aspen-produced J&J vaccine are being administered globally as we speak, the Pfizer-BioVac deal is expected to give us the first mRNA vaccine produced in the continent within the next 12 months. In conclusion, while recognizing the devastation caused by the COVID-19 pandemic, Africa should harness the opportunity to build capacity and capability such that it will be much better prepared to respond actively to the next pandemic. And in doing so, create capabilities that can be more broadly applied to building the continental bioeconomy. I wish you a successful conference, and I also look forward to the outcomes of your deliberation. And thank you very much for listening. You're welcome.
Thank you very much, Deputy Minister. My take-home message from your address, you have put true meaning of the theme of this meeting, advancing Africa's biomanufacturing value chains through innovation. You've reminded us very clearly in which areas where we need to continuously look for the economic dimensions of manufacturing that are going to serve humanity, as Dr. Msomi has said, how these investments can assist in the vision of the executive mayor through the startups that could be set up. So I am extremely delighted with the message. Secondly, you've also reminded us on the landscape in the continent and what's happening in the continent. Again, giving true meaning to the fact that this convention is a convention for the rest of the continent as well. You've told us what's happening in Burundi and in other parts of the African continent, the work that the Africa CDC is doing in the mRNA tech transfer hub with Biovac, Afrigen, and others. And lastly, you've also, without perhaps being explicit, reminded us that these kind of activities of biomanufacturing require huge investments. I am assuming, Deputy Minister, that that means you are still committed to supporting the scientists, the entrepreneurs, and the policymakers in making sure that investments that we are all talking about today and that have the potential to even grow Africa and the rest of the world even better will continue to be received by us from the political principle. So we're extremely delighted and grateful for those words of support. I now would like to move to the last speaker of this session, the Honorable Minister of Health. As we all know, and as I've indicated earlier on, we are aware that he's extremely, extremely busy. But for him to take time from his busy schedule to be with us, Honorable Minister Joe Phaahla, we are extremely delighted for your participation and your leadership in this sector. So may I humbly invite the keynote address to be handed over by the Honorable Minister, Dr. Joe Phaahla. We are trying to establish the Honorable Minister. In the meantime, we would like to move the program forward with your permission. The first slight change whilst we are trying to establish the Minister is to ask if Dr. Msomi could help us with the industry announcements and launches which we were supposed to have a little later, so we will bring that forward. I hope he's been able to alert Dr. Sian Tutela, who was going to help us to drive that program. I hope he can do that rather quickly. And then in the meantime, I'm probably going to request Dr. Msomi if he's able to give us a sense of some of the key areas of the program that he would like us to take note of. So Dr. Msomi, may I invite you to come and quickly update us on some of the areas of the program that you'd like us to note, as well as probably inviting Dr. Sian Tutela to assist with the industry announcements. Over to you.
Thank you, DG. And apologies for the hiccup to everyone. Mine is a quick one. It's just to highlight or to provide some highlights for the program. And the highlights are really based on what the theme of the convention is going to be, the advancing of the biomanufacturing value chains in Africa through innovation. And the program is in 4 tracks, as you are already aware. And the highlights might be a bit biased based on my own preferences. The first track is really the healthcare track, and we start off that track with the key individuals or the key movers in providing adequate supply of vaccines in Africa through manufacturing strategies. And that includes the senior professionals, the senior executives from Biovac and Aspen, Stavros and Morena, as well as 2 key individuals that I'm particularly grateful for their presence. Dr. Martin Friede, who leads the WHO's push for establishing global vaccine hubs in developing countries especially, so that in future pandemics we do not find ourselves wanting with regards to adequate supply. And one of our own, Dr. Tsepo Tsekwa from the CSIR, the minister did mention that in order to be able to do these vaccines, you've got to start upstream and you've got to develop a very strong capability in upstream science and discovery science. And Tsepo will be taking us through that. The next session will be on diagnostics. It's a who's who of diagnostics in this continent, including Mr. Daniel Ndima that has been mentioned twice already. He's an emerging superstar of science. I hope the young stars of today will take a leaf from him. But I also am very pleased to see some old faces who have been involved in diagnostics for the better part of the past 3 decades or so. Professor Wendy Stevens, if you recall last year's Bioafrica Convention, Professor Salim Abdul Karim mentioned that one of the biggest interventions that started to push back the AIDS epidemic was the ability to test. And the lab of Dr. Wendy Stevens at VETS has been one of the key movers in this push. And we have Ashley A's, another young entrepreneur who has stayed the cause in developing diagnostics in this country, more from the side of entrepreneurship. It's a lesson for our entrepreneurs across the country in regards to how we could integrate innovation with entrepreneurial development. And perhaps one of the highlights of the day, I alluded to it, is the presence today. We are grateful of the presence of Dr. Dennis Leota and his lab, the staff from his lab. Dr. Dennis Leota, just shortly, and you will see it in your programs, is the inventor of no less than 17 HIV drugs. He's an inventor of record, and his inventions have really been the backbone that have provided antiretroviral therapy that has pushed HIV to becoming a chronic disease that could be managed as opposed to a death sentence that it was 20 years ago. And we are grateful for his presence. And we then have a session on clinical trials diversity to ensure that when we do clinical trials, they are also aligned to our genomics, or our genetic diversity as Africans, because these are often designed with a particular genetic or genotypes. And this session will discuss how, as Africans, we can start developing drugs that are much more effective, even when they're developed elsewhere, that are much more effective for our genotypes. The second track is on investments and market access, but the more important part of that is how do you use innovation to advance access or universal access to healthcare. We speak about universal access to healthcare glibly. Universal access to healthcare is a fundamental human right. We cannot have a situation where some human beings have access to diabetes medication, some don't because of expense. And so this panel will discuss that, and will be followed by a panel that will also discuss innovative financing solutions, particularly around capital formation, to fund biotechnology. And for us as Africans, and for us in this continent, we have to be doing biotechnology that is not just driven by the need to make a profit as investors, but that is driven by a need to make an impact in our society, food security and all of that. The next 2 tracks are around food security and food safety, and the tracks are run in a parallel session. The closing plenary of the day is building bridges between innovators and entrepreneurs in Africa and in the diaspora. That's the last session of the day. It's a plenary, so it's attended by everybody. And we made mention earlier on of the fact that we have a very young population, but the best way that that population can make an impact is if they partner globally with others, their siblings, who are either operating in the global north, where there's a lot of resources, and they can create some interesting or innovative mechanisms for arbitrage where the resources for doing upstream science and innovation are adequate. They can then be brought into Africa to partner with their counterparts to deliver solutions here. And I'm particularly proud of the individuals that are going to be involved in some of these. Some of them include individuals like Dr. Yemi Onakunle, who is working on a malaria vaccine out of California, VLP Biotech. And this vaccine, malaria vaccine, I mentioned earlier on, would or could start to make progress in rolling back the devastation caused by malaria in the continent. The highlights of the day post this session is obviously our lunchtime session or our lunchtime plenary. So we have a plenary at lunchtime. We have this every year. It's the Women in Leadership plenary. It is our signal to say that we take our commitment to highlight and showcase the leadership of women. We don't do this because it's a cheap political soundbite. We do it because we recognize that in order for us to make progress in biotechnology, in innovation, in science, and in all aspects of human enterprise, we have to include everybody, and that also includes the other 50% that is always excluded from these important matters. And so having women of the caliber of Advocate Mlumbi Peter, Dr. McMary Head, Ms. Angelina and Ms. Bongyo Mlangeni, in a facilitated discussion by Dr. Lwazi Manzi, is an important one because it's going to be speaking about Africa-centric conversation on TRIPS waivers. The TRIPS waivers of patents on COVID vaccine is a very topical issue right now. We as BioAfrica have not taken a particular stand one way or the other, and we hope that this platform demonstrates again that there are so many voices that talk to single issues, and the only way you can start to craft solutions is if you provide a platform for those voices. And the last one is the appropriate human capital development for innovation in Africa, innovation to drive manufacturing and industrialization. And that one is helmed by the vice chancellors and the deputy vice chancellors of some of our premier universities in this continent. And the simple question that they are asking or they are discussing is, are we producing the type of graduates that can address the solutions needed for this world today, needed in innovation, as opposed to doing the same old, maybe Oxbridge or maybe some script taken from elsewhere. And so that conversation is a critically important one because, as I said and mentioned over and over again, that the glue or the engine or the fuel that drives the development of innovation and therefore the delivery of medicines as well as food security for the continent is going to come from the intellectual capital, the human mind, these young folks that are growing up today, and the universities and the higher education institutions having a particularly important task to ensure that the training and the development that happens there is appropriate. Underline the word appropriate as opposed to just training for the sake of doing it. Thank you, and I'd like to hand over to Dr. Ntutela to take over the next part of the program, which is the announcements, the media announcements. Thank you, Dr. Ntutela.
Thank you, Dr. Msomi. First, let me greet the Honorable Minister, Deputy Minister Puti Manamela. Let me greet Your Worship, the Mayor of eThekwini, Councillor Mxolisi Kaunda. Let me greet Dr. Msomi, our President at AfricaBio, and the DG. Thank you very much for driving this program for us. Part of what we do as BioAfrica is to showcase some of these initiatives that we've invested in as a country within the continent, but more importantly, to show that there isn't good research in this country that leads to good innovations that are globally applicable. So this session, brief as it is, it's got 3 announcements that we're going to showcase today. It's in addition to the many showcases during the course of the convention that we'll be talking about, but this one is specifically because we've invited the media and the institutions that are going to announce have got specific announcements that they want to share with the media. So in this order, we have BioCity that are going to tell us about what BioCity Labs is all about, and they will play videos about their initiative, and then they'll also tell us what exactly it is that they want to announce. The second one, the City of eThekwini, driven by Your Worship, the initiatives in the city on what is happening in the space of biotechnology and making sure that innovations go to the public. And then lastly, we'll call TIA to also launch their initiative. I will not say much, but I will call in the IT guys to then play the video for BioCity, and then we'll call the CEO of BioCity Labs, Dr. Deepak Maharaj, to tell us more about what they are doing. Over to you, IT, and then Dr. Maharaj. We will now be joined by Deepak Maharaj from the Cape Town studios. Deepak, are you there?
Yes, can you all hear me? Can you see me?
Thank you. Please go ahead, sir.
Good morning all, and welcome to the BioConvention, BioAfrica Convention 2021. It's set to be a power-packed week at the convention with interesting themes and discussions with dynamic speakers and panelists. I'm Deepak Maharaj, the cluster head at BioCity, and I'd like to take this opportunity to introduce BioCity and invite you all to attend our showcase side event that's taking place at 11 a.m. tomorrow, as well as to join the sponsored session that we're driving on raising biotech startups in South Africa. It really takes a village at 2:30 p.m. today. BioCity is a biotech incubator that is positioned to support the emerging growth in the biotech startups and stimulating our bioeconomy. We're based in Woodstock in Cape Town and provide laboratory access as well as tailored business and technical mentorship to biotech companies to help them grow. But you will get a better chance to get acquainted with us and our vision tomorrow at our showcase side event, where you will get to meet some of the startups we support, as well as get a virtual tour of our labs and co-working spaces. Today, we deliberate on an exciting topic at 14:30 with our experienced panel of experts. Our panel includes Dr. Sibongile Gumbi, who is no stranger in the national system of innovation and has served in various positions contributing to growing biotech in South Africa. And she will share her startup journey as she builds her company, Smart Biotech. Brett Thompson is the CEO and co-founder of Mzansi Meats and is based at BioCity Labs. He will share his story on building a startup in the emerging area of cellular agriculture. Our panelists include Dr. Daniel Ndima, the CEO of Cape Biotech, who will also share some of his journey highlights and challenges. We will then together deliberate over potential mechanisms South Africa can put in place to mitigate some of these challenges with our esteemed panelists, Dr. Sia Bulani, Deputy Director at the Department of Science and Innovation, as well as Dr. Santosh Ramcharan, the Research Group Leader at the CSR Bioprocess Development Group. So please join us in these upcoming events. There is going to be a vibrant discussion of extremely current and relevant topics in biotechnology in Africa. And thank you.
Thank you, BioCity. Now I'll call Ms. Pumla Jali from Invest Durban, who's going to tell us about their initiatives within the city. Over to you, Ms. Jali.
Good morning, everybody, and thank you so much, Dr. Ndutela, for the opportunity. As Invest Durban units from eThekwini Municipality, we are proud to have partnered with Bio-Africa Convention and AfricaBio NPC over the years, especially as the Bio-Africa Convention takes place. We'd like to share with you a bit about our unit, Invest Durban unit, and then also to share with you a good hood story on Belhaven. This just goes to show how science is made real in tackling city challenges. We are proud of this opportunity with Bio-Africa Convention, where we launched 2 years ago the CRISP partnership. So in terms of highlighting programs where the city is playing a role, Professor Tulio de Oliveira will be speaking tomorrow, and then also Professor Michelle Marks from the Belhaven Harm Reduction Center will also be speaking. Today at 11 o'clock, we'll also be sharing with you our potato demonstration trials that we did with AfricaBio, and we would like everyone to come and join in that session at 11 o'clock. Thank you so much, everyone.
In order to attract foreign direct investments in the face of increased global competition, cities need to develop a strong business brand, grow their market presence, and ensure a targeted approach to investment promotion and facilitation. In August 2017, with support from National Treasury and World Bank Group advisors, the eThekwini Council approved the new Durban Investment Promotion Strategy, a definitive step-change approach towards promoting and attracting new foreign direct investment. Invest Durban, a new municipal unit, has been established to drive implementation of the strategy. Invest Durban will be managed and operated as a client-focused unit in the municipality. The strategy's vision is that by 2030, Durban will be Africa's most caring and livable city and a globally recognized preferred African investment destination through the attraction and facilitation of significant foreign direct investment that will stimulate social, financial, and economic growth for all. Implementing the strategy in eThekwini will stimulate employment creation, advance economic transformation, strengthen value chains locally and globally, generate new revenue streams for all in the city, and introduce new technologies, plus enhance our skills development. In order to achieve this, Invest Durban will have a clear 4-part mandate as follows. Firstly, investment promotion. This includes identifying opportunities within target sectors and markets and actively promoting Durban through missions, events, and other channels. Target sectors are chosen to ensure focused and proactive investor targeting and outreach programs. These sectors are in line with sustainable development goals and underpinned by innovation, knowledge creation, and environmental sustainability. Facilitation and servicing. Invest Durban will assist interested investors with packages of detailed information site visits, and hand-holding throughout the investor journey, from initial inquiry to successful establishment. Then comes investor aftercare. Once an investor has established in eThekwini, Invest Durban will undertake critical investor aftercare functions. Through constant engagement with investors and provision of further support to encourage reinvestment, expansions, and more local value addition. The fourth mandate is policy support and advocacy. Invest Durban will generate and gather market intelligence and constructively advocate for improvements in legislation, policy, and processes to accelerate investment. Through these actions, Invest Durban aims to attract up to 33 new FDI projects over the 5-year period, which equates to approximately 3.3 billion rands worth of investment and between 2,000 and 3,300 new jobs. To ensure success, Invest Durban requires the commitment and support of numerous critical stakeholders across all systems. Within the municipality, city leadership will prioritize investment promotion and continue to instill confidence in investors. Team Durban, a new private sector investment advisory forum, will support the city leadership and Invest Durban. eThekwini Catalytic Projects will work closely with Invest Durban in the promotion and facilitation of catalytic projects. Working with Invest Durban, eThekwini's planning and environmental teams will continue to efficiently process all non-catalytic development applications. All relevant eThekwini units will need to help champion investment promotions in their respective units. External to the municipality, Invest Durban will continue to partner with TIKZN, Durban Tradeport, and other government units in local image building and investor servicing. Encourage Invest SA and others in the national sphere to include Invest Durban in marketing campaigns, while streamlining the regulatory applications process through the provincial one-stop shop. With the private sector, we will strengthen relationships with business chambers, industry clusters, and associations to maximize synergies, all the while supporting local economic empowerment. Encourage research institutes and tertiary institutions to undertake and disseminate investment-linked research to stakeholders and investors. In summary, Invest Durban is committed to continually improving the investment environment, proactively promoting Durban as a premium investment destination, and facilitating investment into the city for the benefit of all who call Durban home. The eThekwini Metro has committed financial and human resources over the next 5 years in order to implement this significant step change for Durban. We encourage all stakeholders to become actively involved in supporting this effort. Your leadership in this system is both welcome and essential as we build our nation together.
Drug addiction or drug use disorder is a major issue facing our cities and in fact all parts of society. It's an issue which is often seen as too complex or too taboo to deal with. But here in Durban, through an innovative partnership, the city government, academics, NGOs, business, the police got together to find a way forward. And it started here, inside the iconic Moses Mabhida Stadium, where during South Africa's toughest levels of lockdown, a homeless shelter was set up just inside. The goal? To help those with drug use disorder through what is called opioid substitution therapy.
I meet Monique Marks, the project champion. Curious to find out more about the issue of drug use in eThekwini, she put herself in the back of a police van. This gonzo approach led her to discover methadone. Since 2017, Monique has been a central figure in promoting a harm reduction approach to drug use. She and Michael Wilson manage the Bellhaven Harm Reduction Center. Here, people with drug use disorders come and receive methadone, an opioid substitute which helps alleviate withdrawal symptoms associated with heroin use. They were called on by the city in response to the COVID-19 crisis to implement the opioid substitution program in 2 shelters, which was set up so that the homeless population could follow lockdown regulation. This project demonstrates a unique symbiotic partnership where the city enables non-state actors to make a positive change in their field of expertise in a way which has a wide-ranging impact on the city. This project has not just been championed by NGOs and government departments. Progressive corporates such as Urban Lime and FNB have seen the value in what Belhaven has to offer city spaces and have provided funding and connection.
The partners that are involved, obviously the city provides the building. We don't pay rent for the building, we don't pay rates, we don't pay electricity, we don't pay water. So that's a big saving. The city also provides static security 24 hours a day. Obviously the running of the program is not done by the city, that's done privately by an NGO called Advanced Access and Delivery, which Michael Wilson heads, by the Urban Future Centre at DUT, which I head, and with other NGOs. I'll just mention two. The one is TB HIV Care, that run a needle syringe program from here and provide psychosocial support, and the South African Network of People Who Use Drugs. The problem is that there isn't the provision of resources for cities to run harm reduction programs. That's really where you get the need for partnerships, because it really is the non-government business sector that can come in and do what we're doing here, which is to say, you know, provide us with the basic facility, provide us with a building, provide us with the support to feel safe in the spaces that we're working, provide us with the moral authority by your officials to go forward with a program like this.
Monique, which exact or government departments and agencies actually get involved in a project like this and make the magic happen?
We needed the support of the Deputy Mayor, and actually the Office of the Mayor has also been very supportive. Urban regeneration, because this is a catalytic project for urban regeneration.
Absolutely.
The Department of Health, Social Development and Safer Cities is actually the custodian of the building that we use, and very importantly Metro Police. But what has been amazing is the support that we've got from all sectors of the community around, saying this is what we needed. We needed an intervention that assisted in helping people who use drugs to resolve their drug use disorder, and in some way also to take them off the streets.
It was just this incredible coming together in terms of management between government, between NGOs, between the private sector who were giving a lot of funds for this, as well as private medical centre, working together in unison, creating this enabling environment for the homeless for the first time.
If other cities and towns wanted to replicate this approach, this innovative partnership, where do they start, and is this a big budget production?
All we needed at that point was a table to work from, chairs for the medical staff and the social workers to be able to use, just to be able to sit occasionally and have one-on-one interactions with our clients, and obviously we needed the medication. Other than that, you can do something like this in a very, very, what I call frugal institutional space at a very low cost. The other city that's been doing really well in terms of harm reduction, and it's important that we mention this, is Tshwane, where the local government there does work together, in particular with the University of Pretoria, in providing services to people who use drugs on quite a massive scale. We run fairly differently because our program is what we call extremely low threshold. That means that there are almost no barriers to access at all. It means you're really opening up to almost anybody who presents with a drug use disorder. I think it's really important that cities begin to speak to each other in South Africa, and that we begin to talk about what evidence-based solutions we have to urban problems, like the growth in drug use. That would be a really good place for cities to start collaborating and learning from one another, using, for example, Durban and Pretoria as case studies of where cities have actually backed up programs.
Every day, between 150 and 200 clients come here to receive their methadone dose. The transformation is radical, extending far beyond the lives of those receiving treatment from the center. The ethos of the program is harm reduction, an approach to drug use disorders which focuses on positive change, working without judgment or discrimination. This is way more than a pioneer project to support homeless drug users. It has now become, as Monique calls it, a placemaking project. The surrounding streets and parks have become spaces to pray, linger, and play. Water is provided for drinking and washing, and the clients have taken responsibility for the garden's upkeep. The centre itself, which was once a dilapidated building, has had its original function restored as a community centre.
So really what we want to do is to break down the sort of divisions between people who use drugs and other people. I mean, it's a false division anyway. And so what we want to do is to activate the space so that people use it and that there's a sort of communication and engagement between people who don't see themselves as active drug users and our drug use community.
Before this, I never looked at the homeless people the way I look at them now. They have such amazing stories behind them, and it just takes a little bit of time to listen to them and understand them. So it's a huge impact. It's a huge difference.
The big breakthrough is how the centre and its partners, such as city officials and police, think about urban issues. Drug use or homelessness are symptoms of deeper issues and will not be resolved by punitive intervention. This has been recognised by the Metro Police, who are partners in the programme. They now approach law enforcement in a more empathetic and holistic way.
What we've learned today is that this space, the Belhaven Harm Reduction Centre, is more than just a building to provide treatment and services to those suffering with drug addiction, but it's a placemaking project, a public space, an idea that could be rolled out across South Africa.
Thank you, the City of eThekwini, for that very exciting project that you're doing to curb this scourge of drug abuse. Now, our next announcement is going to be only videographic from Tia, who's also a partner to the convention. Over to you, Tia. And before Tia starts, we want to make sure that everybody knows that our session will resume at the normal time, which is 11 o'clock, but I'll tell you more after the TIA announcement. Technology Innovation Agency.
Good day, I'm Dr. Lucius Steenkamp, Director of the Industrial Biocatalysis Hub and Principal Researcher at the Council for Scientific and Industrial Research. And it's my privilege to introduce the Industrial Biocatalysis Hub to you. Now, biocatalysis entails the use of enzymes and microorganisms in manufacturing processes to produce products such as industrial biologics, biopharmaceuticals, bioveterinary, flavors and fragrances, also food and feed additives, and nutraceuticals. And they can also be extracted from plants, which then can be used in dietary supplements, cosmetics, nutraceuticals, food and feed products. The Department of Science and Innovation has identified biocatalysis as one of the key enabling technologies to support the development of a sustainable industrial bioeconomy in South Africa. The establishment of the Industrial Biocatalysis Hub was then identified as a vehicle to expand the biocatalysis value chain. The DSI and Technology Innovation Agency then established a funding partnership, and the CSR was selected as the implementation partner for the hub following the selection process by both entities. The implementation model stands on two legs, or two pillars. The hub at the CSR will identify SMME partners as well as industry partners interested in support for biocatalysis technology development, and through an open call will assist these companies to develop and commercialize technologies. The other pillar will be the selection of 4 to 5 nodes with specific biocatalysis skills at universities, and will be required to perform research that will lead to publications, technology progression, as well as postgraduate training. Previously disadvantaged higher education institutions interested in developing biocatalysis capacity will also be identified through this call. The expression of interest calls to be one of the nodes at the universities or one of the enterprises interested in research has been published online and can be found at www.sbs.co.za. www.csr.co.za, and the closing date is Friday 3 September 2021. The Industrial Biocatalysis Hub, hosted in the Chemicals Cluster, will have access to the Biomanufacturing Industry Development Center, the BIDC, as well as the Biomanufacturing Innovation Development Facility in Durban. And these two centers have a proven track record of transferring technologies to industry partners. Not only do the facilities at the CSR house all the infrastructure, equipment and skills to take biocatalysis related ideas from proof of concept to pilot scale, but has also demonstrated the ability to transfer the technologies to industry partners for commercialization. The Industrial Biocatalysis Hub has been capacitated with funding to offer the following: use of infrastructure as well as skilled human resources, which includes scientists, technologists and process engineers relating to biocatalysis and biomanufacturing, technology development, technology validation, scale-up support and techno-economic validations, bio-based product formulations and development, packaging as well as labeling, mentoring and training in manufacturing skills as well as expert analytical support, and method development, which includes GC, UPLC MS and NMR. For more information on the Industrial Biocatalysis Hub and to access information, please go to www.csr.co.za, or you can send an email for information on the calls to ibh@csr.co.za. Thank you.
Thank you to Tia and Dr. Steenkamp at CSIR for that exciting work they're doing. Now, colleagues, our guests, delegates and panelists, we want to let you know that the program again will resume as it is originally planned from 11 o'clock. The parallel sessions will start together with the side events. So we call on you to come back again and join us at that time. I must thank the DG of Science and Innovation, Dr. Phil Mjwaha in Pretoria, for driving the past session for us. So let us meet colleagues again at 11 o'clock. For now, network if you can. Thank you.